Dear audience, welcome to Leadership Lens, an exclusive interview-based program by the Financial Express, where we bring you in-depth conversations with leaders who are shaping our economy, society, and future. In today's Leadership Lens, we are joined by Professor Nathan Congdon, Director, Research and Tech Advisor, North Asia Clinical Service, Orbis International. We'll discuss with him research opportunities on eye care in Bangladesh, the link between poverty, eye problems, and the way to address eye health issues in Bangladesh. Let's welcome Mr. Nathan Congdon. Mr. Nathan, we have learned that Orbis International has recently forged a collaboration with PKSF. So what sort of opportunities you see in terms of research under this collaboration?
Fantastic. It's a great question. This is a very exciting opportunity overall for Orbis and for Bangladesh. Bloomberg Foundation is the funder of this project, and Bloomberg has invested in the past in areas like traffic safety and water safety, but never in vision care. So this is their first foray into support for vision care. They've selected Orbis from all the different organizations in the world they could have chosen, and then particularly they've chosen Orbis Bangladesh. So it's very exciting for us. The opportunities with PKSF are that these are two different organizations, right? Orbis is principally interested in blindness prevention and eye health, whereas PKSF works in communities here in Bangladesh to try to carry out poverty alleviation. It turns out we've got a lot more in common than you might think between these two organizations. Orbis is increasingly interested in the idea that vision care, low-cost vision care like cataract surgery and glasses, can be an exceptionally powerful poverty alleviation tool. What we're interested to do now with PKSF, the exciting opportunity, is to work with PKSF as a community-based organization and look at how some of the exciting tools that they have, microfinance tools, risk mitigation tools, health insurance, if you will, to see how some of those microloans and other things can help families to afford to have cataract surgery that might not have been able to otherwise. And that's obviously important for both of our organizations. We want to make sure that this project can continue. We want to make sure that there can continue to be beneficiaries. But it's also important to our donor. Bloomberg Foundation has a lot of money, but they also recognize that it's not inexhaustible, and they want to see clear evidence from us after the first 2 years of work together that we have a concrete, data-driven plan to see how cataract surgery can be scaled and sustained after their donations are no longer there. So that's going to involve research. It's going to involve initially capturing information about our population of patients that will get cataract surgery, information about their families. What we're currently exploring is the idea that cataract surgery can help the beneficiaries to return to work, either inside of the house, doing economically important things in the house, or even paid labor outside of the house. But beyond that, the caregivers, the family members who are spending time taking care of these patients, who are currently not able to care for themselves because they're blind, once that blindness has been taken away by our partners with a very high proportion of success, we know from well-done cataract surgery, that means those caregivers can also re-enter the workplace. We think that in and of itself is going to be transformative. It's going to be an opportunity to really change lives through vision surgery, which is what Orbis is all about. We also think, though, that it may make these beneficiaries and their families more likely to take up some of the tools, some of the loans and low-cost health insurance that PKSF offers. If that's true, that's very exciting to Orbis because it shows the potential for low-cost vision care, not only to help people to see again, but potentially to open the door to better health in ways that they maybe have never experienced before. So those are the kind of things that we want to test and study and learn, and hopefully harness that learning to be able to improve the quality of the program and increase the number of people who can benefit from cataract surgery in Bangladesh.
That's exciting. There's a direct link between eye health and poverty, economic emancipation, and many more. Anyway, my next question is from local and national perspective, which area you find more exciting and more potential for investment, future investment?
So it's a good question. Assuming for the moment that the investment that we're talking about is to try to achieve the Sustainable Development Goals and to try to alleviate poverty. These are the goals of the Bangladesh government, as many other governments in the world. There are several areas within eye health that are very encouraging and offer great optimism for those chances. First of all, we know that even a simple pair of glasses can make a huge difference in lives. Most of us, the way we work, whether you're a professor or a farmer, we work with things that we can reach out and touch. Once we reach a certain age, usually around 35 or 40, our ability to see those things that are near, the tools that we work with, gradually and naturally erodes, it gets less. But luckily, a simple pair of glasses can help to bring that back. And it's been demonstrated here in Bangladesh, in India, and other countries, through work that Orbis has done, through research, that delivery of a simple pair of reading glasses can be quite important in the workplace. We've shown that tea pickers will increase the amount of tea they pick by 5 kilos a day. We've shown that people working in garment industry can improve their efficiency working in the factories. And we've also demonstrated here in Bangladesh that we can increase earnings over 6 months by 30% among people who are working in handicrafts, shopkeepers, working in a variety of different areas. So glasses in and of themselves, very encouraging. We also know that an important goal of development is for children to learn better. We have strong evidence from China and other places that delivery of glasses helps children to do better in school. And it does so with greater impact than any other healthcare intervention that's been looked at in schools, bigger impact than giving iron and vitamins. It also has a bigger impact than family income and parental education levels. So it offers a huge opportunity to redress inequities in society. And then of course there's the intervention that we're involved in with our partners thanks to the generous donation of Bloomberg, which is cataract surgery. Cataract surgery has been shown to increase the economic well-being of families. What we propose to do now is to better understand exactly how, whether it's mostly the beneficiaries, whether it's the caregivers, and use some of the tools that have been uniquely developed here in Bangladesh, like risk mitigation, low-cost health insurance, microloans, to try to increase that impact and have an even larger development impact. So those would be the 3 most important areas. There are others though. We've been very active, Orbis has, with our partners, working in diabetic retinopathy. So diabetic retinopathy is the damage that results to the eye from diabetes, which is increasingly a problem in Bangladesh and other countries as Western diets and things are adopted. What we're finding is that the vision loss that accompanies diabetes, if it's not well managed, is actually the leading cause of blindness among people of working age. So obviously when a working age person loses vision, that impacts on that person's whole family and community. Coming up with better solutions to diabetic retinopathy, better treatments, better approaches to try to improve uptake, that's also a source of focus of Orbis research that's ongoing right now, funded by the Lions Foundation, and it also offers a huge development opportunity to help to keep these working age people able to be productive and support their families and communities.
So you are going to do some research under the project with PKSF. How can the experience gathered from here can contribute to global learning and education in public health, particularly eye care?
So it's a great idea, great question. Obviously, what governments are trying to do is to understand, looking across the healthcare landscape, what are the best investments? No country, even the richest countries in the world, can afford to purchase all the healthcare that's out there. You know, we have globally aging populations that our healthcare needs are getting more and more all the time. And of course, we're developing new medications and new treatments all the time. So the potential cost of healthcare is constantly rising. What that means is that any country, no matter how rich, and especially countries that have somewhat limited resources that they can invest in healthcare, they need to know what are the best bargains in healthcare. This research we propose is going to help us to demonstrate that cataract surgery is one of those best bargains in healthcare. We believe that at low cost, we can have really substantial impact on the earning power of households, not only through the beneficiaries, the direct beneficiaries, but also by relieving those who are caring for them of that burden and allowing them to return to work, to earn additional money. The additional money that they earn in turn benefits a whole other range of sustainable development goals and aims that the government here and elsewhere in the world want to see. Improved educational outcomes for children. We propose that as these caretakers, who are largely younger women, as they no longer have a burden of caring for someone blind from cataract, they're going to have more time to spend with their children. And that's going to have direct educational benefits on those kids. So there's a lot of different ways in which a simple cataract operation, which takes 15 minutes and can cost less than $50 US, a lot of different ways in which that can change lives. We're proposing to do high-quality randomized controlled trials with PKSF and expert Bangladeshi economists to try to demonstrate exactly how much return on investment is there for cataract surgery for governments like those of Bangladesh. Knowing strong evidence from trials showing that vision care is one of these best bargains is hugely important for countries as they look across the whole menu of healthcare and they try to decide, what can I afford to order that's going to have the biggest impact on the health and broader development well-being, work, opportunities for livelihood, for education for my population. We're very confident that our evidence is going to show that healthcare comes right up at the top of the league tables. It's going to be transformative for governments around the world.
At Orbis International, you are working in diverse areas of eye care. Can you please mention 3 or 4 areas that can make great contributions to sustainable development in next 4 or 5 years?
Sure. So we talked about some of this stuff. We've mentioned already that delivery of glasses can be especially important. Those glasses have a number of different effects. They're so simple. You and I are both wearing them, you know. We may have paid a lot for the frames, but you know, a pair of glasses only has to cost $5 or $10 US. Those glasses have been demonstrated to, as we mentioned, to improve productivity and earnings of workers. They've been proven to improve educational benefits for kids. Orbis is now exploring another exciting area within healthcare. We believe that glasses can also improve the mental health of children and adults. Currently, Orbis is involved in a research project, a randomized trial called SWISH in China. That's looking at the potential for glasses to improve the mental health of children. We know that kids, particularly kids who are in very competitive educational environments, if those kids are sitting there and they can't see the blackboard, the result is going to be substantially increased burdens of depression and anxiety. Those are really have a massive impact on quality of life, productivity. There can be a negative knock-on effect. I can't see well, so I can't learn well. That makes me depressed. That makes me learn even worse. So that trial will be completed in November, in only about a month and a half, and we expect it's going to show that glasses can substantially improve the mental health of children. We're also doing a trial called CLEVER, Cognitive Level Enhancement through Vision Exams and Refraction. The idea behind CLEVER is that we've known for many years that declines in vision and declines in cognition go on at the same time. As your eyes become less clear, your mental facility becomes less clear as well. The question is, can low-cost vision care, can a pair of glasses turn that around and help to protect, slow the pace of cognitive decline and prevent dementia? The only way to find out is to do a high-quality randomized controlled trial, and we're in the middle of doing that now, as I mentioned, in both India and in China. If that turns out well, that'll be very exciting. You know, the burden of aging is a big problem. With that burden, countries like Bangladesh and India are spending some 1% of their GDP on caring for people with dementia. Currently available treatments are very expensive, medications that can cost tens of thousands of dollars a year. They're not going to work very well in the Bangladeshi context, not on a high level for many people. But a pair of glasses can. So that's something we're extremely excited about. We're also interested in looking at retinopathy of prematurity. That's a common problem among children who are born too early. Those kids will have problems where their back of their eye, the retina, doesn't develop the way it should. There's strong evidence that a child who goes blind from retinopathy of prematurity, the lifetime cost can be as high as $250,000 US, whereas the treatments for that condition only cost a few hundreds. So Orbis is working hard with our partners here in Bangladesh, and has been for many years, coming up with good quality models for the management of retinopathy of prematurity, screening children as soon as they're born, identifying those who need treatment, and getting out messages to communities so that mothers know that if their children are born too early or too small, that they need to make sure to get them eye exams. So the number of different conditions that can have a big impact on life, well-being, development is huge. And it covers a number of different sustainable development goals. We've mentioned already mental health, which is part of healthcare, SDG 3. We've mentioned SDG 5, which is education, and SDG 1, which is poverty alleviation. There's another one that's worth talking about. One of the SDGs, I think it's number 8, talks about safe cities. A city like Dhaka, the biggest health risk that young people here face is actually traffic crashes. Between the ages of 5 and 29, the leading cause of death around the world, not just here in Bangladesh, is traffic crashes. 90% of that burden actually occurs in lower middle income countries, even though only about 60% of the cars are here in lower middle income countries. We strongly believe that improved vision can help to prevent those crashes. We're doing a trial that Orbis is involved in called STABLE in Vietnam, slashing two-wheeled accidents by leveraging eye care. STABLE is looking at young motorcycle drivers in Vietnam, providing glasses to them, and then putting small cameras onto their motorcycles and actually following them by video as they drive around, trying to demonstrate that under real-world conditions, a simple pair of glasses can help to reduce crashes and crash risk for that population. And obviously those young people, they're an incredible, important resource for countries like Vietnam and Bangladesh. Those young students who are of high school and college age, they represent the future. So being able to prevent those crashes is incredibly important for countries around the world, particularly lower middle income countries where the crash burden is so high.
You are doing a lot of research and implementing a lot of programs, how these research and programs are contributing to the public health outcome in the long run?
So it's a good question. We've talked about some things that happen right away in the short run, and that's part of the excitement. We can do randomized trials that can capture safer driving, that can capture better cognition, clearer minds, that can capture the ability of children to learn better. We can do those over the course of a year, 2 years, 3 years. That's affordable, that's manageable. What we can't do, of course, is follow for the long term. So what are some of the long-term benefits that we think can accrue? I think one of the most exciting ones is the idea that if we're successful in working with PKSF to get people who are wanting cataract surgery, if we can get them to purchase low-cost health insurance, that health insurance, that risk mitigation, is going to help them to avoid problems like diabetes and hypertension over decades. So it shows that we know that governments tend to underinvest in vision care, as they think if somebody goes blind, they're not going to die at least. It's not like cancer. We think the long-term benefits that we will demonstrate in this project we're doing PKSF here in Bangladesh will show that in fact vision may not kill people if they don't have it, but the desire for better vision can open the door to health care and can promote people's access to care for diabetes and hypertension that can help to save lives over decades. So that kind of long-term thing I think is extremely exciting and interesting.
So you have interacted with a lot of people, stakeholders in eye health care. So in your perspective, which areas are still unexplored in Bangladesh and where Orbis can work more?
That's a great question. So I think we've had in my field of vision research, when we look at public health approaches to improving helping to achieve the SDGs, we've tended to focus on two types of treatment. Tended to focus on glasses and cataract. And part of the reason we've done that is those things are common. Those are the most common causes of vision loss, myopia and cataract. We're interested now to begin looking at another type of eye disease that's very common, but tends not to cause vision loss, at least not in the short term. And that's what we might call red eye. So I think we all have seen children who come home from school and their eyes are red, sticky, watery, they stick shut, hard to open up. Those conditions are very common, and in fact in places like Bangladesh and India and Africa, we're learning now, recently, that they may actually be even more common than the need for glasses. What we're interested to look at, and this is new work, this is just beginning now in India, Bangladesh and other settings, we believe that we can come up with school-based approaches to treat those conditions, to screen for them. If we want children to see better, we can't just wait for parents to seek care. That approach is going to benefit the top 5 or 10%, the parents who are most educated, but it's going to leave 90 or 95% of kids without access to care. So we need school-based approaches. We're interested now to begin to test school-based approaches to red eyes, particularly allergic conjunctivitis. We think that can include low-cost, over-the-counter eye drops that could be delivered in school so that we don't have to wait for parents to get these, we can deliver them through school, and potentially behavior change. One of the things that causes the biggest problem with this allergic conjunctivitis is that kids are uncomfortable, and so they rub their eyes. Rubbing the eyes actually makes it worse, makes it more itchy. You can imagine, if you scratch an itch, it gets worse.
Right.
We think if the teachers can help to do some very simple behavior change things, like telling kids, if you're itchy, rub the area around the eye, don't rub the eye itself. Or maybe we could give the kids little toys that could sit, a little toy puppy that sits on the desk. Don't rub the eyes, rub the puppy. Together with simple treatments to reduce the itchiness, we think that can reduce those diseases. So what kind of benefits do we get if we actually can prove this works? We feel, we haven't shown it yet, but it's our hypothesis that this disease, this very common allergic conjunctivitis that we haven't yet begun to treat in schools, that if we do treat it, we think that it will allow children to learn better. Many children have these conditions. They're really itchy and uncomfortable. We think that's probably reducing those kids' ability to concentrate in school, reducing their ability to come to school, and that if we can do these school-based treatments, we have potentially another tool to help improve learning for children. The tool of delivering glasses is most impactful in areas where, like urban areas, where kids are doing a lot of studying. Allergic conjunctivitis is more common in rural areas. You can imagine in Dhaka, I've been here for a few days, this is my third or fourth visit, I haven't seen a lot of plants growing in Dhaka. So there's not going to be a lot of allergic conjunctivitis here in Dhaka. But out in the countryside, where our programs are being done now, obviously those plants are everywhere. The pollen is everywhere. Those allergic conjunctivitis problems are more severe. So we think that we can help education, we can leverage educational improvement, particularly for kids in poorer areas, if we can work on this allergic conjunctivitis problem. An additional thing that we think is very exciting and interesting is when kids rub on their eyes like that, over time it causes damage to the front part of the eye, which is a very strong tissue if you think about it. I mean, you know, if you get punched, it's not going to pop the eye usually. But that tissue, if it gets rubbed vigorously over time, it can break down a little bit. And what happens is a condition called keratoconus, where the shape of the cornea is no longer round. And it becomes very difficult to manage with glasses. Those kids actually sometimes need corneal transplants, which are impractical for most kids in Bangladesh. So we think this new approach, something we're just starting to try, of managing this problem of allergic conjunctivitis in school, may not only help in the short run to improve kids' academic performance in school, but also has the potential to prevent blindness over many years later. That's an exciting new area that we're hoping to move into soon.
So what opportunity do you see for researchers in Bangladesh to address these gaps?
Lots of opportunities. So right now here in Bangladesh, we have a number of exciting projects going on. So I've already mentioned to you about cataract. The generous donation of the Bloomberg Foundation is helping us to carry out a large cataract surgical program that will benefit 100,000 people. 1 million people will be screened through PKSF, and 100,000 of them will receive sight-saving cataract surgery. That will provide us a research platform to be able to study the impact of cataract surgery on improving the economic and social well-being of families. That's an exciting project. We've talked about that some. We are also carrying out a program right now funded by the Lions Foundation looking at diabetic retinopathy, which I mentioned, the leading cause of blindness among working age people. What we're examining there is the idea, and this is the first study here in Bangladesh, first study in the world to look at this, that delivery of vision care, integrating that into diabetes care, can actually improve the overall quality of the diabetes care, not just the vision care. What we're looking at is the idea that both a supply and a demand side. On the supply side, when we are examining the eyes, instead of just telling doctors who are caring for these patients, gosh, your patient has diabetic retinopathy, we're telling them, your patient has this problem, and this is a sign of damage. That damage means that you as a doctor need to test their blood sugar, their blood pressure, and their lipids, and find out whether they're normal. And if not, you need to change their treatment. So that means that the vision care can serve as a kind of reminder, a nudge, to help doctors improve the care, the diabetes care that those patients are getting. Then on the demand side, as a patient is diagnosed for the first time with diabetes, we're not just telling them, gosh, you should really be sure to show up for your visits and take your medicines. What we're saying is this condition can cause blindness. It's a common cause of blindness. But if you take your medicines and show up regularly for your diabetes examinations, you can reduce that risk of blindness by 95%. You can make it go away. So we're motivating people, giving them the information to motivate them to be compliant with their diabetes care. So we think on both the supply and the demand side, eye care, if it's properly integrated into the care that people living with diabetes receives, can lift the quality of that care. We're also looking at a novel question about tea pickers. I mentioned that previously Orbis did a study in India that showed that we could increase the amount of tea that these pickers would harvest each day by 5 kilos a day, 22%. That's a greater improvement than has ever been seen in any other healthcare trial in the workplace. Now in Bangladesh, we want to take it to the next level. We want to provide glasses to these tea pickers in an ongoing project that Orbis is doing. Orbis has a project that that will be benefiting some 60,000 tea pickers at 21 different tea gardens. We're going to look, as we deliver glasses to these women, not just at the impact on their productivity and their earnings. We believe that the additional earnings these women will bring home just as a result of getting glasses can help them to provide better for their children, better nutrition, better educational opportunities. So that's a pretty exciting thing. If it turns out to be true, we're testing it. A simple pair of glasses not only improving the vision of the individual, but potentially having knock-on benefits for the next generation. It's a very exciting idea. It would be an incredibly powerful impact for a very small investment, because these glasses only cost, even including the cost of delivery, only cost $3 or $4 US. So these are just some of the really exciting projects that we're looking at. Orbis is involved now. We have our own homegrown artificial intelligence, our own AI. It's called CyberSight. We're using CyberSight now here in Bangladesh, and we're doing some of the first testing in the world to try to show that the use of CyberSight can increase the number of people who are accurately referred for diabetic retinopathy. So the idea is that we can use this technology to help deliver eye care to more people. This echoes a previous study that we did in Bangladesh. We've been busy in Bangladesh, I can tell you. It's called Be Productive. The Be Productive study looked for the first time also at artificial intelligence, and it asked the question of whether artificial intelligence can improve the productivity of healthcare workers. What we found is that it sure can. The use here in Bangladesh at the Deep Eye Care Foundation of a kind of autonomous AI that can test and screen for diabetic retinopathy itself, using that as a pre-screen and helping to make it so that busy retina doctors who are giving care don't have to see normal patients. They can focus on the complicated patients who need their help. We were able to improve their productivity by 40%. That article was published in Nature Digital Medicine, and it won a prize in 2023 as one of the 3 most important AI innovations in the world that year. We just got beat by ChatGPT. So, you know, it shows, I think, that the quality of research that we're able to do here in Bangladesh is at a global level, at a world level. It's highest quality research published in the best journals, but more importantly, it can serve as a vehicle to improve not just the vision, but also the development opportunities, the economic and social opportunities for people in Bangladesh, both children, their mothers, adults, whole communities. It's very exciting. It's one of the reasons I love to come to Bangladesh so much. It's a very entrepreneurial area, always ready to try new things. I'm sure you know what they used to say back before partition. What Bengal thinks today, India thinks tomorrow. And it's very true. Up until now, this kind of inventiveness that we see in Bangladesh, it creates an incredibly fertile ground for us to do groundbreaking research. One of my favorite places to work.
Thank you so much, Mr. Nathan Congdon, for joining us and spare a chunk of your precious time.
Sure. Thank you very much for inviting me.
Dear audience, that concludes this episode of Leadership Lens. On behalf of the Financial Express, thank you all for joining us. Stay tuned as we will bring you more conversations with leaders who are shaping our economy, society, and future.